Hi everyone. In this clip, I will talk a little bit about lactose intolerance. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So, lactose intolerance is when our body can't break down or digest lactose. Lactose is a sugar found in milk and milk products. Lactose intolerance happens when our small intestine does not make enough of a digestive enzyme called lactase. So lactase breaks down the lactose and in the food so that our body can absorb it. People who are lactose intolerant have unpleasant symptoms after eating or drinking milk or milk products. So lactose intolerance is not the same as having a food allergy to milk. It's a bit different. So both children and adults can get lactose intolerance, and some common causes of this condition are, in some cases, the small intestine stops making lactase after an injury or after a disease or after infection. Some babies that are born too early, premature babies, may not be able to make enough lactase, and this is often a short-term problem that will go away. In very rare cases, some newborns can't make any lactase from birth. Each person's symptoms may vary. Symptoms often start about 30 minutes to 2 hours after we have food or drinks that have lactose. Symptoms can include things like belly or abdominal cramps and pain, nausea, bloating, gas, diarrhea. How severe the symptoms are will depend on how much lactose we have had. It will also depend on how much lactase our body is able to make. The symptoms of lactose intolerance can mimic other health problems as well. So to diagnose lactose intolerance, they usually perform tests like a hydrogen breath test. This is when they give you a drink of a liquid that has a lot of lactose in it. And then they test your breath. They check your breath several times, and high levels of hydrogen in the breath means that you're lactose intolerant. This is the most common way of testing. Then there is, of course, another test which checks how your digestive system absorbs lactose. You will be asked not to eat or drink anything for about like 8 hours before the test. And this often means that not eating after midnight, basically. For the test, you will drink a liquid that has lactose. So then some blood samples will be taken for over a 2-hour period, and they will then check your blood sugar level or blood glucose level. And if your blood sugar levels don't rise, you may be lactose intolerant. There's also something called stool acidity test. This test is used for infants and young children. It checks how much acid is in the stool. If someone is not digesting lactose, their stool will have lactic acid, glucose, and other fatty acids in it. So conventional medicine does not offer a treatment that can help the body make more lactase, but they can teach you how to manage your symptoms by changing your diet or by using lactase supplements. Here are some tips that they offer you for managing lactose in your diet. For example, they will say start slowly. Try adding small amounts of milk or milk products and see how your body reacts and which one gets a more severe reaction, and stay away from the ones that give you the severe reaction, obviously. Have milk and milk products with other foods. You may find you have fewer symptoms if you take the milk or milk products with other meals. Try eating cheese with crackers, for example, or having milk with cereal and not alone. Eat dairy products with naturally lower levels of lactose. These include hard cheeses and yogurt. Look for lactose-free and lactose-reduced milk and milk products. These can be found at many food stores, basically, and they are the same as regular milk and milk products, but they have the lactase enzyme added to them. Lactose intolerance can affect you every time you eat a snack or meal, so you need to be careful about the foods you eat every day. But many people can tolerate a certain amount of lactose and don't need to completely give it up. It's important to read the food labels because lactose is often added to some boxed, canned, frozen, and prepared foods, like, for example, bread, cereal, lunch meats, salad dressings, cakes and cookie mixes, coffee creamers. Check food labels for words that may mean food has lactose in it. Things like butter, cheese, cream, dried milk, milk solids, powdered milk, or whey. So now, on the other side of the fence, you need to remember that enzyme lactase, which, as I mentioned, is responsible for breaking down lactose, is produced in the small intestine. Specifically, it's produced by cells lining the small intestine, known as intestinal epithelial cells. These cells have tiny finger-like projections called microvilli that help absorb nutrients, including the products of lactose digestion. I have personally seen amazing results and reversal of this situation by supplementing the lactose intolerant individuals with a good multivitamin, calcium, magnesium obviously, vitamin D3 plus K2, enzyme complex, and major doses of pre and probiotics. Probiotics, especially bifidobacterium, can help alleviate symptoms of lactose intolerance by improving lactose digestion and or manipulating colonic metabolism. But I would get something with 11 or more strands for general gut health, and not just bifidobacterium, of course. Now, psychological factors can significantly impact and cause the experience of lactose intolerance symptoms that they also need to be addressed, obviously. We have something called the gut-brain axis, and this is a complex communication network that links the brain and our gut. This is why stress and anxiety can lead to digestive issues, including lactose intolerance. Emotional stress can impact the gut in several ways, such as altering the gut mobility, which will lead to faster or slower digestion and change of microbiome. This metaphysically also can be seen as rejection or difficulty receiving nurturing love and comfort. Unwillingness to take in something, whether it's a person, a situation, or even parts of yourself. I hope this has been helpful. Like and follow for more. Be the light.